Hello, friends. Welcome to Pathology Academy. In today's video, we will be talking about one of the most powerful tools in diagnosis in pathology, which is immunohistochemistry or IHC. So, let's get started. Immunohistochemistry combines morphology and molecular precision. It detects specific antigens in tissue using labeled antibodies and is integral for tumor classification, diagnosis, and prognosis. The principle of IHC is simple yet powerful. An antibody binds to its specific antigen in the tissue. A secondary antibody linked to an enzyme like peroxidase reacts with a chromosome such as DAB, forming a visible brown precipitate under the microscope. Now let's discuss the applications of IHC. IHC helps in identification tissue of origin, subclassify tumors within organs, detect prognostic and predictive markers, and screen for molecular alterations and infections. In poorly differentiated tumors or metastasis, IHC helps in pinpointing the cell of origin. For example, cytokeratin indicates epithelial origin or carcinomas, vimentin suggests mesenchymal origin or sarcomas, Dismin and SMA highlights muscle tumors, S100 and Milan A mark melanocytic lesions, CD45 confirms lymphoid lineage, and synaptophysin and chromogranin suggest neuroendocrine tumors. Also, within a single organ, IHC help us subclassify tumors. In the lung, TTF1 and napsin-A identify adenocarcinoma, while P40 and CK56 mark squamous carcinoma. In the liver, HepAR1 and arginase 1 distinguish hepatocellular carcinoma from metastatic adenocarcinoma. In the breast, ER, PR, and HER2 not only classify but also guides therapy. IHC has revolutionized lymphoma subclassification. For example, CD20 and PAX5 are B cell markers, CD3 and CD5 are T cell markers, CD10, BCL6, MUM1 are helpful in subclassification of diffuse large B cell lymphomas. IHC is the gateway to personalized oncology. Markers like HER2, ERPR, PDL1, and Ki67 predict therapy response and prognosis, making IHC central to patient management. IHC also identifies pathogens directly within tissue, for instance, cytomegalovirus, Epstein-Barr virus, LMP1, or P16 as a surrogate marker for HPV infection is used. Certain IHC stains serve as surrogates for molecular alterations, for example, P53, IDH1, ATRX, MMR proteins, etc., are useful for gliomas, colorectal carcinomas, and MSI screening. IHC bridges morphology and molecular biology. It's fast, cost effective, and applicable to routine FFPE tissue, making it ideal for daily diagnostic use. However, accuracy depends on proper fixation and antibody selection. False positives from cross reactivity and subjective interpretation can occur. Hence, always interpret IHC in morphological context. To summarize, immunohistochemistry is the cornerstone of modern tumor diagnosis. It helps classify tumors, identify lineage, and predict therapeutic outcomes, truly merging art and science in pathology. Don't forget to subscribe to Pathology Academy YouTube channel if you are liking my videos and keep commenting. Thanks and bye for now.